Hello everyone, this is Dr. Cui. So in this video, I would like to discuss another negative question the interviewer may ask you: what's your biggest failure in life? So by answer this question, we need to know that it can be you can tell the interviewer if you have a if you really have a big failure in your life, or you can just tell them that although I have no big failure, but I have some small fail. I have some small failure, small ones that I can share with you. You can definitely talk about that experience. And actually, the answer for this question is pretty similar to the question like what's your weakness. I experienced that you have to adapt quickly or stay in your med school, something like that. So you can check my other videos about those answers, and actually we can definitely apply those answers to here, and also focus on how did you overcome the failure. Don't just see how big the failure it is, how difficult it is. The interviewer is more interested in what did you do for after the failure, and what you learned from it, and what experience you gained from it. So always add a reflection at the end of your story or experience, as I mentioned. Um, just let them know that from during the failure you learned a lot of things and improved yourself. So here's my answer. Okay, Dr. Cui, so can you tell me what's the biggest failure in your life? Um, yeah, that's a interesting question, I would say. Although I have no big failure in my mind during my in my life, well, I can share with you some smaller ones, I would say. For example, uh, when I was a medical student, my that's the first day I went to the clinic, and my supervisor wanted me to draw the blood from the patient. Although I practice a lot in my school, still I'm not confident to do it for a real patient. So I filled 3 times the same patient. The patient complained of that and asked the nurse to draw his blood. And after going home, I feel a little frustrated, and I watch the videos and read the textbooks again, and to find out what's wrong with my technique. And in the same day evening, and I went to the clinic and draw blood by myself by using my own arm, and I succeed. So in the next day, I felt pretty confident, and I draw blood from another patient successfully without any problem. You see that in this experience, I learned that no matter how difficult it is, how hard a task it is, I try my best to hang on there, and practice makes perfect. Practice helped me to master that techniques. So sooner or later, I will succeed. So that's what I learned from this experience. So you can see that I just try my best to focus on how did I improve from those failure, and what I learned from it, and what experience I gained. So, and also it's related to the clinical skills, which means I want to let my interviewer know that I'm also good at I'm also good at um, draw blood from the patient. So that's one of my skills I can show him. So I think that's all of my suggestion I can give to you. Hope you will also create your own answer and do well in your interview.